Approximately 25 million adults in the United States are affected by chronic venous insufficiency, or CVI, a condition that affects the veins in the legs and makes it harder for blood to flow to the heart. Well, here to share more on this diagnosis is Dr. Foster Gaillard, vascular surgeon for Roper St. Francis. Good to have you with us.
Thanks for having me.
This doesn't typically get the limelight as, say, deep vein thrombosis. A lot of people have heard that term before,
Absolutely.
but until the President of the United States was diagnosed with this, now it's starting to appear on more people's lips. What is the difference between the two?
Well, it's a very distinct difference. DVT is a clot or blockage that occurs in the leg vein and can also occasionally result in clots traveling to the heart and lung. Generally a fairly dangerous diagnosis, and we treat pretty aggressively. Chronic venous insufficiency is better thought of as an inefficiency in how the blood returns. Blood has to fight against gravity and the pressure in our abdomens in order to make its way back to the heart, and venous insufficiency is basically not doing that the way that it needs to.
What causes it?
There is some genetic predisposition, family history of varicose veins and things like that. Blood clots themselves can lead to venous insufficiency, but essentially what it is a failure of the valves which help the blood flow back to the heart, and it causes backwards flow through those valves that leads to the symptoms.
Does lifestyle also impact whether someone gets diagnosed with this?
It can. One of the mainstays of treatment is actually exercise. A more sedentary lifestyle can lead to leg swelling and some of the symptoms.
We're seeing
but
a lot of
it
that
isn't,
these days.
Absolutely, but it's not directly associated with that in a strict sense.
Okay, it sounds like quite a few people. It's relatively common.
It is.
And does it happen more in men or women?
Fairly equal distribution, maybe slightly towards women, but the symptoms are such a large spectrum. I think that's why it's underappreciated how common it is. It can range from something cosmetic, such as spider veins and varicose veins, which can be more symptomatic, to very difficult to heal venous-static ulcers and long-term leg swelling and pain. So most people don't always associate the less severe symptoms with a true diagnosis of venous insufficiency.
Do you have many patients coming in wanting to be diagnosed, thinking that there is something wrong? I mean, can you tell what are some of those symptoms? Because when you talk about spider veins and varicose veins, a lot of times that's cosmetic, and people like to treat those just to make the surface of their skin look a little bit more even. So how would you know that that could be a sign of a far deeper problem?
The presence of a varicose vein in and of itself almost confirms the diagnosis of venous insufficiency. We would follow that up with an ultrasound as a more confirmatory test.
And that's like a protruding vein?
Yes.
Okay,
correct.
We've seen those.
Yeah, spider vein is more of a bluish flat vein that you would see on the skin, whereas a varicose vein is the actual bulging vein. And while those tend to be more cosmetic, varicose veins can be symptomatic. They can cause medical issues, bleeding, or clots to form in them. So there are other reasons that we treat the varicose veins a little more aggressively. The spider veins tend to be more cosmetic problem.
We also tend to see those varicose veins as people age. So would you say that the older you get, the more propensity for a potential diagnosis?
Yes, that'd be correct. And like I said, there is some family history. Very commonly, patients who come in to discuss their varicose veins, they'll tell me everybody on my mother's side or everybody on my father's side has this issue as well. But yes, in general, the symptoms are more likely as we age.
What about shortness of breath?
Less commonly with chronic venous insufficiency specifically.
Okay, so nothing too I mean, aside from the obvious varicose veins, any other obvious symptoms that people might recognize?
There's actually 6 stages. Varicose veins and spider veins are stage 1 and 2. Beyond that, we see leg swelling or edema. We can see darkening discoloration of the lower leg, and that generally occurs in kind of the ankle, just above the ankle region. That's called hemosiderin deposition. That can lead to inflammation and pain, and then ultimately result in venous ulcers from that chronic inflammation. Fortunately, the large majority of patients don't progress from one of the lower stages to the later. They usually present one way or the other, but all of those fall in the category of that diagnosis.
If it doesn't get treated, what happens?
I think it depends mostly on where you're presenting. So if you present with severe symptoms, pain, swelling, darkening of the skin, or ulcers, that is likely to persist, if not get worse. In general, I counsel patients that in the earlier stages, compression, elevation, exercise often keep symptoms from progressing.
That's why a lot of people wear compression socks on planes.
Correct.
Yeah. Could you suffer a heart attack or some other pulmonary issue because of this?
So there is a slight association with chronic venous insufficiency and an increased risk of DVTs that you asked about before.
Yeah.
Like I mentioned, DVTs can break off and travel to the heart and the lungs, but no, venous insufficiency does not generally have a direct correlation with heart artery or peripheral artery disease.
Okay.
In general, it's good to think about the artery and vein side of the circulations as two sides of one coin.
All right, well, if anyone out there is watching that is recognizing any of the symptoms that we're talking about, they need to come and see you and get a further diagnosis. All right, just before we go, I want to make sure that we mention this. Roper St. Francis Berkeley Hospital just rolled out its new Heart and Vascular Center just late last month, and this highlights some great technology there, including a computed tomography, let me see if I can say this properly, tomography coronary angiogram, so it's a CT scan and among other things. So doing great stuff out in the community, Roper St. Francis Hospital. Thank you so much, Doctor. Appreciate you coming in.
Thanks for having me.
We'll be back after this.